Hello and welcome. Today we'll be discussing hemorrhagic cystitis, a condition involving inflammation of the bladder accompanied by bleeding into the urine. We'll explore its causes, symptoms, diagnosis, treatment, and more, providing you with a comprehensive understanding of this sometimes concerning condition. Hemorrhagic cystitis arises from a variety of sources. Infection, particularly by bacteria or viruses, is a common culprit. Certain medications, most notably cyclophosphamide and ifosfamide, both chemotherapy drugs, are known to cause it as a side effect. Radiation therapy targeting the pelvic region can also trigger it. Less frequently, it may be related to underlying conditions like bladder cancer, autoimmune diseases, or, in rare instances, be idiopathic, meaning the cause remains unknown. The pathophysiology of hemorrhagic cystitis involves damage to the bladder lining, specifically the urothelium, and the underlying blood vessels. When the urothelium is injured, the bladder's protective barrier is compromised. This allows blood vessels to rupture, leading to blood entering the urine. Inflammation further exacerbates the situation, increasing blood vessel permeability and promoting continued bleeding. The severity of bleeding can vary significantly, ranging from microscopic hematuria, detectable only under a microscope, to gross hematuria, where the urine appears visibly red or bloody. The exact incidence of hemorrhagic cystitis is difficult to determine and varies depending on the underlying cause. Chemotherapy-induced hemorrhagic cystitis, for example, affects a notable percentage of patients receiving cyclophosphamide or ifosfamide. Radiation-induced cases occur in patients undergoing pelvic radiation for cancers like prostate or cervical cancer. While infectious cystitis is common, the development of hemorrhagic cystitis as a result of an infection is less frequent and often related to specific pathogens or immunocompromised individuals. Understanding the context is crucial for appreciating the epidemiology. The hallmark symptom of hemorrhagic cystitis is hematuria, or blood in the urine. This can manifest as pink, red, or even dark brown urine, depending on the amount of blood present. Other common symptoms include frequent urination, a persistent urge to urinate even when the bladder is empty, painful urination, dysuria, and lower abdominal or pelvic pain. In severe cases, blood clots may pass in the urine, potentially causing urinary obstruction and further discomfort. Diagnosis of hemorrhagic cystitis typically involves a thorough medical history and physical examination. A urine sample is analyzed to confirm the presence of blood and identify any infectious organisms. Urine culture and sensitivity testing are performed if an infection is suspected. Cystoscopy, a procedure where a thin, flexible tube with a camera is inserted into the bladder, allows direct visualization of the bladder lining to assess the extent of inflammation and identify any underlying abnormalities. Imaging studies, such as CT scans or ultrasounds, may be used to rule out other conditions or complications. While hemorrhagic cystitis isn't typically classified into distinct types, it's important to differentiate between the underlying causes, as each etiology will influence the treatment approach. For example, chemotherapy-induced hemorrhagic cystitis requires different management strategies compared to the caused by a bacterial infection or radiation therapy. Treatment for hemorrhagic cystitis focuses on controlling the bleeding and addressing the underlying cause. Hydration is crucial to flush out the bladder and prevent blood clots from forming. Bladder irrigation with sterile saline solution may be necessary to remove blood and debris. Medications, such as antibiotics for bacterial infections, antiviral medications for viral infections, or hemostatic agents to stop bleeding may be prescribed. In severe cases, cystoscopy with cauterization, where bleeding vessels are sealed, or hyperbaric oxygen therapy, which promotes tissue healing, may be considered. In extreme circumstances, surgery may be needed. Preventing hemorrhagic cystitis depends on the underlying cause. For chemotherapy-induced cases, medications like mesna are often administered alongside cyclophosphamide or ifosfamide to protect the bladder. Adequate hydration is important. For radiation-induced cases, radiation techniques that minimize bladder exposure are preferred. Maintaining good hygiene practices can help prevent bacterial infections. Regular checks and prompt treatment of urinary tract infections are also crucial preventive measures. The prognosis for hemorrhagic cystitis varies depending on the underlying cause and the severity of the condition. Most cases resolve with appropriate treatment. However, recurrent episodes are possible, particularly if the underlying cause is not adequately addressed. Recent research focuses on developing more effective bladder protectants during chemotherapy and radiation therapy, as well as exploring novel therapies for refractory cases of hemorrhagic cystitis. Gene therapy approaches are also being investigated for promoting bladder regeneration after radiation damage. Continued research aims to improve outcomes and reduce the burden of this condition. Thank you for joining us today.